Now the aspect of Anaesthetic Pro that we want to look at today is the report section. When we come to the report section, we see that we have a number of criteria that we can search on. So if we look at total drug use, it brings up a layout that we can select either pre-anesthetic sedation drugs, general anesthetic drugs, pain management medications, or reversal agents. So if we come back to our pre-anesthetic sedation drugs, we can then select a date criteria to actually search on, so we'll just make that today, and then we click on the individual products, and in this case with ACP we've only got one use, and that was Casey Jones, and we had 0.23 mils in total used of the 2 milligram per mil strength. Now if we come across and we have a look at under pain management, we look at morphine. We have 3 uses today. That's 2 of the 10 milligram per mil strength and 1 of the 30. And so we can see our total volume of 10 milligrams per mil, and same with the 30. Now we do have the option here of printing this out as an Excel spreadsheet, or we can actually print it and save it as a PDF if we so wish. So we'll just cancel that, and close that down. What this side of the reporting system allows us to do is to keep a check on restricted drugs such as morphine. Now obviously it's only good as the end user, so if people do not put in the volumes that they've used or undertake the calculations in Anaesthetic Pro, then they're not going to show up. But certainly it's an adjunct to our whole recording system, so if for example you just want to go through and just check off the uses of products like morphine against your restricted drug record, then you can do so. Now if we close the section and we look at the next side of our reporting system, it's for individual patient drug use. So obviously we'll go on the same search criteria as we did on the last looking at today, and in this situation you can place in various criteria. You can put in the animal surname or the patient name if you want, or the species even, or you can search under clinic if you so wish. In this situation we'll just do it under date, and we'll do a complete search, so it will actually bring up 14 records, and these are records that have been undertaken today. Now the first one is for Casey Jones, who's a little dog, and in this situation Casey's had ACP, atropine and morphine. Now there will be circumstances where you'll undertake a calculation and save it and then change your mind. Now if you leave that calculation in the system, it will throw out those figures, particularly with products like morphine. So what is advisable is to bring that calculation up under this report section and then delete it. And if you do that, it will actually remove that from the database so that it's no longer part of it, and therefore your records will be kept as accurate as you possibly can. But it also is useful if you want to go back and to see what medications Casey had previously when he came in for an anaesthetic, say 2 months ago or whatever. So it's useful information for us to have at our fingertips. And that's pretty much it for today. Thank you.